before. So tell us more about yourself. I know you've been in this community about a year. So tell us where you came from, what got you into healthcare administration.
So from Austin, Texas originally. My dad is a healthcare guy. He ran a multi-specialty practice. My mom's a trauma nurse. And then my grandmother is a nurse. And how I got into healthcare really is it's all I know. And I was going to go to medical school, and my dad, who runs a 150-man multi-specialty group, said, if you want to change healthcare, go run a hospital. And I've been very lucky with the company I work for. I've been with HCA for 18 years next month. Traveled a little bit around the country, have been in Tampa and Hillsborough County, but also in Myrtle Beach, in Las Vegas, and now back to Largo, and really excited about being here. My grandmother tells me often that you can't hold a job down because I move so much, but it seems to be something that's been very advantageous for me, and it really is an honor to be here.
18 years with HCA, boy, that must be a record. All right, so, we're seeing an uptick. Let me share my screen, which has the Pinellas County data up there. Here we go. So, that's directly from the Pinellas County. As you can see, the confirmed cases, which was refreshed on January 24th in Pinellas County, is 4603, and total tested is 8223. And then, if you look at the capacity, let's go back to the previous screen. There's some graph I wanted to look at. There we go. So if you look at the May, Adam, so we had a regional spike in April in Pinellas County, and then May, the cases went down, and June, look at the peak right now, we having post-Memorial Day, 2 week of gestation. What's the impact of all this? And walk us through, from March, where we have hardly any cases in Pinellas County, how's the HCA response has been, and now we have a, uptake, which is, much, much higher than where we were before. How is it impacting the hospital, HCA, West Coast? Walk us through.
Yeah, and I think that you're exactly right. March, April, and May, there was a lot of talk in the country about COVID, but in our area, hospitalizations hadn't moved until yesterday. And yesterday, we're starting to see a little bit of a spike, but are starting to really see that those patients are starting to come in and convert more to hospitalization. So we haven't gotten as high as we were back in April or May, but are climbing. And it is something we're a little concerned with. Now, the good news is the hospital is an unbelievably safe place to be right now, because we've gone through the COVID crisis, if you will, the first time, learned a bunch of lessons around how to clean better, how to treat the patients better, but also how to keep everybody safe. And I think you're seeing us start to put those practices back in place. Anybody in our facility has to have a mask on. Anybody that's going to be in front of a patient for more than 15 minutes, is a mask and a shield and gloves, and doing all those things to make sure that we're not only protecting our staff, but protecting the patients. And we've just instituted the no visitation policy without, some unbelievable reason to be in the building, just to keep everybody safe. And I think that what you'll find is our cleaning protocols and all the things that we have in place right now keep our hospital safe. Because the one thing that we saw at the end of May that was really scary was the people who were scared to come to the emergency room. And they didn't come with chest pain, and they didn't come with stroke symptoms. And 2 weeks later, when they did come in, the problem was we couldn't fix it. And you saw a lot of 50-year-old, 60-year-old chest pain patients that waited a month with chest pain, and when they came in, it was a heart attack and not a good outcome. And I would encourage anybody that's out in the area that needs emergency care to seek that. Our emergency rooms, 1, have capacity, and 2, are unbelievably safe at this time if you need us. and we are here for you in the community. The hospital, while it has spiked a little bit, is still fully capable. We still have things going on that are still saving lives outside of COVID. And if you remember, if we have 20 patients in-house right now, I've got more than 200 patients that don't have COVID. And I think we've got to stay focused on those 200 as well, because there are a lot of other things going on. Maybe there is somebody who needs a heart transplant or a liver or kidney transplant, all of which we continued during the COVID crisis. And there are some things in the community, even if you don't have COVID, we need to be focused on you. And I think those are something that are important points, because just because you get sick and you don't have COVID, you still got somewhere to go.
That's a great point. I'm glad you brought it up, because there was a lot of analysis going on with during the hotspots in New York and New Jersey and other places. Where did the patient go with heart attacks and strokes? And and they still found that on the death records there are heart attacks. So unfortunately, patients are suffering at home and worried that the hospital will give them COVID, and they don't want to get the appropriate care, which, as you know, and I know, that if they go within a certain time frame, let's say if it's a stroke, they go within 3 hours, they can get a lot of aggressive thrombolytics and, treatment, which can prevent if they're going to have any paralysis, or B, death, unfortunately. So, and same thing with the heart attack, all the hospitals, emergency rooms are geared towards stroke alerts and STEMI alerts. So, that they are losing the advantage of the healthcare. And the COVID is not the only killer, but, we need to learn to live with it, because the way things are, as we've seen, that, there is no respite. New York, New Jersey is not a hotspot now. Arizona, Phoenix, Texas, South Carolina, Florida, somewhat, are uptick. So we got to figure out how to do the elective procedure safely along with the COVID cases. And I think that's the challenge, what you just addressed. So, and then, in terms of fatigue, so that's what I want to address with you. The staff, the nurses do a fabulous job at Largo Medical Center, and all the medical techs, and, they have a big heart, and, a lot of places in the country, they are the heroes, they're true heroes. But, what we've seen in other countries is they ran away, from the institutions. So you got to give kudos to all the heroes in United States, which are still doing double duty or extra hours. So what do you think, how are you going to manage the COVID fatigue in your staff?
Yeah, and that's a difficult question, because you've got your nurses and your doctors who we remember to thank, but you forget the people who are cleaning the rooms and the people who are doing some of the other things. So anybody with a hospital badge on is a hero in my book. And I think we're trying to make sure that we can keep them, one, encouraged, but two, keep them unbelievably safe. And I think the thing that is striking to me when we start talking through, their heroes and those things, when you talk to the nursing staff, they're so unbelievable. What they'll tell you is, we're just doing what we do. This is what we were trained to do. We were trained to take care of patients. Is it changed a little bit? It has, but it's what we're trained to do and what we love to do. And I think what you'll find at the heart of all of our heroes is they're here to help people. And I think that's something that's encouraging. So we'll continue to keep them safe. We'll continue to provide them an environment where they can do what they do, but make sure that they are, one, safe, feel safe going home, and then hopefully can continue to take care of our community.
That's a great point, Adam. And that brings me to the next question. So, I know it's been very difficult with everyone looking for the PPEs, everyone, competing for the same ventilators, everyone competing with the same supplies. How do you stand? I know you guys were, so far, as a physician who's been with Largo Med for 25 years, I want to commend Largo Med, because when I went there in the last 3 months, I never had any issues getting any PPE. So you guys has been very generous with the PPE so far. But, as we saw on the graph that, there is going to be, there is already an uptick in the cases. So the question is, do you guys have enough sources and supplies in place? And, what can you tell the community?
So, we're very fortunate. We're part of a very large company. We have 200 hospitals nationwide in 39 states. And I think the ability for us to buy on a macro scale is something that is a huge advantage for Largo. And we are able to call our parent company and say we're running low. In this particular instance, we have plenty of PPE. We have been very strategic in how we're buying all supplies. And not only do we have it stored locally, but if the spike continues and we need more, it's a couple of phone calls and we have what we need. So I think, I don't have any concerns with PPE or ventilators. We again have been very strategic in our buying and sourcing and making sure that when we have hotspots, whether it's here or some of our friends and sister hospitals in Texas, that our whole company is supporting those hotspots so that we are able to take care of our patients in the best manner possible.
So since you brought the topic of HCA being the largest hospital chain, that gives you the advantage of learning from your sister hospitals in New York, New Jersey. Any tips they shared how to deal if, God forbid, we get the hotspots in Pinellas County?
Well, I think that it's the policies and it's the way to treat patients and it's all those things that we're learning from. Our first hospital that received patients in HCA was in California. So it was 2 weeks before Florida had their first patient. And so in those 2 weeks, we had all the knowledge that they learned in California and other places. And I think we're continuing to pass on, well, we've tried this works, this cleaning process tends to keep everybody safer. This process makes sure that your staff stay safer, and also even treating patients. We've had doctors from our hospital calling some of the facilities out west and talking to, these physicians that have been seeing COVID patients for weeks and months on end, making sure that we're up with the latest and greatest technology and process to take care of those patients. So I think it's a huge advantage because, not only do we have that, but we also have, our connections inside, New York and some of the other places that were all over the news telling us, this is what we saw that was successful and don't try that because that doesn't work. Because I think the medical community as a whole is learning together. And I think one of the other powerful things that's happened during this COVID crisis is the health systems in Pinellas County have kind of come together, whether it's Baycare or HCA or Advent. We have been able to, in Tampa General, we've been able to, as a group, kind of come together and make sure as a system, a healthcare system, one healthcare system, that we are sharing kind of the crisis together and helping with all the things that we know, whether it's sharing policies or sharing, you need to take this patient and I'll take that patient. I think that cooperation keeps our community safer. And I think it really does show the power is if we communicate and if we're willing to cooperate, the system, but also the community as a whole wins. And I think we'll continue that partnership.
That's a great point. And, that leads me to my next question, Adam. So, I read an article in New York, New Jersey, once the peak hits, though, first the models were incorrect. They were, suggesting a lot of patients coming in and that many patients didn't come in, thank God. And, the facilities, the makeshift facilities in Central Park or, the stadiums were never utilized. And which is good. You want to keep the patients in a hospital setting if they are sicker instead of makeshift setting because they are makeshift. So what I saw is that in that article, the hospitals there were very innovative. They use, let's say, auditorium and they change that into, COVID floors. God forbid we get a uptick like that. How do you coordinate the offline beds? Let's say every hospital has offline beds. How do you coordinate? Okay, now I saw on the data up in Pinellas County that, 73%, 74%, and then the emergency, the ambulances were on the reroute because there is less capacity. So walk us through who coordinates that. Is there a coordination central point? How does it, in Pinellas County, the hospital bed situation get sorted through?
Well, and it's good. I think that communication, we got a practice run in April and May. So in June, when it's starting to really kind of affect us, we've gotten some of the kinks worked out. Again, that partnership between the health systems has been key, but the coordination really starts with our Department of Health. So Department of Health is really leading the charge with Sunstar, who is the ambulance provider. There are calls every day. Coordinating where are we seeing particular upticks, or we've got this particular situation where we need to move a number of patients here or there. Representatives from all the health systems are on the call and we have leaders in each of the health systems making those decisions. So, if it's coming to an HCA hospital, we have one leader that kind of makes those decisions for our sister facilities, Palms, Northside, and St. Petersburg, along with Largo, and we're able to coordinate that within each of our systems. Baycare has a similar representative, and so does Advent, and then Bayfront downtown. So again, I think that coordination has been key. Department of Health has really stepped up. We also get support from the county commissioners, and they are all in tune with making sure that our community, one, is safe, and then we can support our true partner, Sunstar, to make sure that they have somewhere to offload this patient, and we can get EMS back on the road to take care of whoever needs their help.
That's a great answer. I got a comment. Let's see. Latita is asking, how can we safely open hospital to visitor? Do you think we'll stay closed to the visitor until 2021 and beyond? That's a great question, Latita. I think Adam touched on that. We'll touch it again. See if you can answer that question.
I think for us, we're trying to keep everybody safe. And I think that having visitors in the building, we don't know what they come in with. And then also, if they come in and they are COVID positive and they infect a doctor or a nurse, we've taken resources away from patients that need them. And I think that's something we're trying to be incredibly sensitive to. Now, there are exceptions to all rules. And I think that one of the things we're fully committed to is if there is a case where we have a patient in urgent crisis that, a family member needs to be there, we are making exceptions to that. And I think that any of our admin team will be very sensitive to make sure especially if a patient is in a life situation or is facing a critical surgery or something like that, that we'll make those accommodations. But that's really a case-by-case basis, because the best scenario for the hospital is to make sure we're focusing in all resources on those patients that are inside the hospital, and we're making sure that they're taken care of. So will we continue? We had no visitation policy until about a week or so ago. We opened it a little bit. The COVID crisis has kind of resurged, and we closed again. So I think we'll be closed to visitors without a pretty unbelievable situation for a while, until we start seeing this spike down, so that we can make sure that not only the patients in the building that trust us every day we can hold safe, but we can keep all of our staff members and team members inside the building unbelievably safe. And I think safety has got to be where we stay focused. And then we've got to employ empathy and hospitality, making sure that we are taking care of some of the patient needs, because there are particular cases. One that pops to mind now, an older gentleman who has been a patient of ours who needs his family member next to him. There's a reason specifically behind that. And of course we make those accommodations. There are blanket rules, but there are exceptions to rules. And I think that as long as the family and our team are communicating together, we can make the best decision for the patient at the bedside.
And I think you bring a good point. And, I see that a loneliness in the ICU, and you got to have compassion, and unfortunately you got to make sure the staff is safe too. So and so it's a balance, and compassionate basis, as you said, you can make exception, but you have to look at a bigger picture. So let's move on to the next question. So far you have to balance the bottom line, which is through elective procedures, and which got opened up 2-3 weeks back. And as you rightly said, there is a bottleneck of procedure not being done, and that start patients and surgeons who are waiting on those cases start doing it more. So now that's going to start filling up your post-surgery ICU beds. And now you have a big uptick, 1,000 cases a day in Pinellas County. So how the hospital system will balance the elective procedures and the COVID cases coming up more?
Yeah, and I think elective procedures is kind of a misnomer that we all need to kind of think about the definition. Elective procedure means that a physician has decided that a patient needs a procedure. And it may be something that can wait a day or two, but a lot of times these procedures are in and out the same day. And I think that one of the things that probably happened a little fast is we decided that the reason we cut off elective surgery was to conserve PPE. it wasn't as much capacity because a lot of the elective surgeries that we're doing don't stay in the hospital. And, very rarely does an elective surgery end up in an ICU. And bed capacity is something we keep an eye on, but surgery, elective surgery typically is one that we can, cut off on a moment's notice if there is some sort of surge in the bed situation that changes. I don't know that a blanket statement on elective surgery is all that good. Part of the situation we're dealing with now is there's a backlog of patients that went without elective surgery for 5 or 6 weeks, and that elective has turned into not elective anymore. And so there are some cases now that are being done that can't wait, and because they've been waiting for 6 or 8 weeks. And think about if you are having a pain in your gut that it's an appendix. Well, is that elective or not? And that's a tough decision. And what we're trying to make sure that we do is we treat everybody that a physician has decided they need some sort of intervention, because you as a physician aren't going to suggest surgery or suggest some sort of procedure unless you really think it's warranted. And I think our partnership with our physicians, will trust them to make the decision that this individual procedure or case or test needs to be done, and we'll do our best to make sure that happens, keeping everybody safe. We'll only get and reduce elective surgery as kind of a last resort, not necessarily because of the financial reasons, because again, there are negative clinical outcomes that come along with that. You think people that decide to have elective surgery, they've rearranged their whole life, because there is a recovery period, and we need to make sure that we're treating those patients as well. Again, 10% of the patients could be a COVID patient, 90% aren't. And we got to make sure that we're taking care of the whole, because again, the community as a whole needs to have these things continued. So, my recommendation to all the county commissioners and to, our government officials is we keep that open and let the physicians decide what is necessary and what's not.
Yeah, I think that's a great answer, because, elective is just catch-all kind of basket, and, you got to be careful, because if there is an ailment which you don't treat right away, that can lead to catastrophic complications, and then it's become more difficult procedure down the line. So yeah, you got to balance it out. You can't just cut it out altogether. And especially we saw how adept and flexible the hospitals are in Northeast, in the hotspots, in getting offline beds back in play if they need to. So if you do a knee-jerk reaction like you were saying earlier, and you stop all the procedures, and then there is other mortality and morbidity other than COVID too. So you got to do case by case, and not overdo on procedures which can wait. Sure, they should wait. So let's go off the COVID situation. I know you guys doing a fantastic job with your transplant center, and we're very lucky that you're the only transplant center in Pinellas County, and the people don't have to go to Tampa General and Tampa Bay. So tell me about the milestones you guys have achieved. It's been what, 4 years now, I think.
It has. So our kidney and liver transplant program has been alive for about 3 years and in place. We did 11 kidney transplants during the month of May, which was great. We were able to focus in on those patients that needed those particular organs, and they were desperate for those, and that was just an unbelievable experience. Also in May, we got to do our first heart transplant, and our first cardiac transplant was done right in the middle of the COVID crisis. We've done 3 since then, so 4 total. It is super exciting. Our first patient was so exuberant and had so much energy. It was fun watching him leave the hospital, because he popped out of his wheelchair to the doctor screaming, slow down, and you couldn't slow him down because he had a new heart and a new outlook on life. And I think that we have several great stories like that. And I think one of the things that, even in the midst of a crisis and even in the middle of a storm, our surgeons, our physicians, our nurses, and all the teams that were along with them were able to, literally change people's lives, because, before the transplant, they're facing a bad ending, and now they have a new look on life. And, when you need a heart and you get a heart, your life changes. And I think that that's something that's really been exciting and a great asset to the community. Our outcomes are top notch, first class, and it is amazing when you look at what both our surgeons on the liver and kidney side and the cardiac side are able to do. And they are unbelievably talented. And I think we're very privileged to have world-class surgeons in Pinellas County and at our hospital. And I'm very proud of that, both of those teams.
And I heard from Grapevine, Adam, that you guys going to have a certified stroke center coming soon. Tell us about that exciting news.
We are. So comprehensive stroke is something that there's only one center in North Pinellas County, which is just north of Ulmerton Road. September 1st, we are opening our comprehensive stroke center so that we can treat all of our patients in the Largo area without them having to go anywhere else except here. And when we say comprehensive stroke, if you have an aneurysm or need a coil or a clip, we're able to treat that, but also have some advanced specialty training around just stroke in general. And that seems to be a pretty hot diagnosis in this area. A lot of patients need that stroke care, and we're just going to up our game. Really looking forward to that, putting in a machine, building a room for those coils and clips, but more importantly, building our resource bench to really take care of those patients that have the stroke so that we can put that life-saving care in place. If we can get to them quickly, we really are able to keep the negative things from happening a lot faster and get those folks back to their normal life. And I think that's something we're excited about.
That's very exciting for, Pinellas County to have two comprehensive centers, come September. So that'll give them choices. And, you guys have more private rooms. So a lot of patients love that aspect about Largo Medical Center. Tell me, in terms of, any other exciting news coming up in next few months or year horizon from what our patients or community wants to know about from you?
I think it's renovation. I think that what you'll see is on our Indian Rocks campus, you're going to see us completely redo all the outside and the inside so that it is world class. I think you're going to see us also expanding our services on both campuses, but making sure that that emergency room, but also that facility on Indian Rocks Road is fully capable, which it is now, but increased capability. I think you'll see us add some service lines around psych medicine that are very exciting for the community that are not here. I think when you look on the main campus, on the 14th Street campus, again, you're going to see us really sorting and shining and doing a lot of neat things from a facility standpoint, but also continuing to add depth. And I think when we add depth, it's partnerships with our physicians. We're adding a advanced GI physician in the latter part of this year that is going to be able to help us detect cancers and other things in the abdomen. That's your word, not mine. But I think that
we got that. We got that, Zeus.
I think that it's making sure that we have those depths of services. I think you'll see us expand our cardiovascular services, continue to expand what we can do in neurosurgery, really focus in on brain tumors. We have an unbelievable physician who's recruited a partner, Dr. Schulman, who's a neurosurgeon who really does a lot around spine, but also her love is brain tumors. And, that doesn't sound exciting until you have one, and you need the best hands. And she is unbelievably talented. And I'm looking forward to what we're able to do with that. Those cases have historically left Pinellas County. We're looking to keep those home so that they can do that. And then expanding our general surgery service lines to where we're a lot better at handling if we can find that you have an issue, but making sure we have unbelievably skilled hands to take your general surgery case, whether it's colorectal, it's breast surgery, and making sure we have a doctor that can serve you in the way that you need to be touched. So I'm really excited about some of the partnerships we have with physicians that are going to offer some new service lines that really will change the face of our community because they won't have to leave to do that.
That's a fantastic news, and good to see that you're partnering with skilled physicians. I think a lot of it is a team which includes a skilled physician along with the equipment and support staff. So you need a full team. So it's good to get more, I think the transplant center has brought a lot of skilled surgeons to your institution. And I think that does help to attract more skilled physicians. So, that's a great kind of a magnet. One last question, Adam. In fact, two last questions, unless we have comments. Do send us comments if you have any question for Adam. I know he's a busy man, so we're going to let him go in a few minutes. So just send us a quick question if you have one, and give him some love. He took time off from his busy schedule to spend time with me, and so we appreciate Adam doing that. So one quick question I have, which is from me, Adam. You have such a huge building in front, the old diagnostic clinic building, and I'll pitch in my idea, which I liked before, and I pitched it to you. So I'll do it on a public forum to put you on a spot. But I know there was some thought about making a oncology center there earlier, and there was some thought about moving the cardiac or the fellowship program and the residency program there. And before that, there was a thought I really liked, which is to put a daycare center for the nurses. And I think that will be a good attribute. I know it's hard, a lot of logistics and legal aspects to that, but that'll be a good attribute and help to all the heroes, we have working in Largo Med to, get them a gift of having their kids right there, and they are not worried about it. So, but I'll leave it to you to pitch in the rest.
Well, thank you for setting me up for that one. I appreciate that. So I think that that building, we bought it a couple of years ago. We have spent a lot of money kind of building the box, if you will. So it is a blank building and a blank slate. And I think we are actively trying to figure out, what does that slate look like? Is it office space? Is it an oncology center? Is it a surgery area? And all those things that we're trying to in development. COVID has kind of slowed some of those plans a little bit. Again, as capital turns into cash. We're trying to figure out what the back half of this year looks like. I think the scariest part is the ER volume has dropped. And, elective surgery, we took a little bit of hiatus there. And what does our new healthcare world look like? And I think we're going to have to let that develop a little bit before we start spending money developing that building, just so that we can ensure that we have the proper dollars to take care of our clinical teams and our staff members, but also, the instrumentation that our physicians need, and then ultimately the things that our patient needs. And I think we'll try to figure that out over the next 6 months. And I'm sure as we talk, you'll continue to remind me of your ideas, and we'll address those. And I really do appreciate your partnership in that, because I think it's from our physician partners that the great ideas come from. And I really do appreciate that we have lots of physicians with lots of ideas about that. So maybe we'll all get together, and y'all can all bang on me together. It'll be fun.
So, any final words of wisdom with what you learned from your colleagues and throughout the country, throughout the COVID? We're going to come back to COVID because that's what we're facing. It's unprecedented in terms of scope, and we don't know when it's going to end. So it's a new normal. We have to live with it. So if you have to give your, what you absorbed from what you learned from all the people who worked, what will be the top 3 things you'll tell the community?
Wash your hands. Wash your hands, but wear a mask. And this is a tough one because nobody thinks we should. It is such a easy thing to do. And what we're finding with all the research across the country is that it is one of the easiest things that we can do to keep this from spreading. If my mother is listening, she does not think she should wear a mask. So Mom, put a mask on. And I think the last thing is, practice the social distancing. I think all the things that you're seeing in the news, it's not just to irritate us. It really is something that they're seeing. Science is showing that it does help. And, if you are asymptomatic and you have COVID and you have a mask on, you are protecting anybody you come in contact with. And I think, if you're in the younger generation, we're seeing the spike in that 25 to 34-year-old range. If they all had masks on, it doesn't get to the 70-year-old where it becomes a real problem. If you're over 65 and you're not wearing a mask, you're not paying attention. Because this disease is something that really becomes scary for that population 65 and over. And that 65 and year old and older, the hospitalizations almost triple your percentage. And then, the mortality rate is a scary number inside there. I won't even mention it on live TV. But I think that what we would encourage you to do, again, wash your hands until they hurt, wear a mask, and make sure that you're keeping distance from the people that you can, and practicing those things that we're seeing in the news, because I think they're all things that will help you.
I think that's great advice. And, I hammer that with my community on every podcast, so you're preaching the choir. But if there are other folks listening, I second those thoughts, Adam. And I want to thank you for taking your time out from a busy schedule and giving us a update, which was very insightful, because a lot of folks were interested. How's the HCA and how's the Largo Med prepared? And that should give them a lot of confidence. If they have any chest pains or left side not working or right side not working, that's not the time to sit at home thinking they will get COVID. They should call the paramedics and go to the nearest hospital. I think that's a good takeaway from you. And I think with the advantage we have in terms of slowly learning from the other colleagues throughout the country, which has given us a little bit heads up in terms of how to deal with both situations, the regular cases of heart attack, stroke, aneurysm coming in along with the COVID. So I think if we have to take one take-home message from your conversation, I think that's a good take-home message. Don't suffer at home with non-COVID situations just because you're worried that you'll get COVID in the hospital. And the hospitals are doing a great job with all the precautions they are taking, as you alluded to. So thank you so much, and keep up the good work. And I want to see in 1 year a nursery and a daycare in that building, along with your fancy suite.
Thank you for your partnership. I think you do a great job for our community, and I do enjoy, and I look forward to our numerous discussions about this that you want to see.
All right, Adam, I'll let you go. Thank you so much. And if you want to hang out, I'm going to do some breathing exercise. If you want to sit there, you want to do that breathing exercise with me, you have a few minutes, do it with me. Or if you have to run, you can run. It's up to you. All right, guys. So Adam did a great job. And he's a great partner and very approachable. So we appreciate him coming in and addressing our concerns as a community. So we're going to wrap it up by doing some breathing exercises. I do want to reiterate that what Adam just said in terms of doing the social distancing, in terms of wearing your mask, in terms of washing your hands. I think it's just that I know you're going to get sick of listening to it, but that's the only thing we have right now to reduce the number of cases and flatten the curve and reduce the people going to ICU. I was reading an article, in fact, today, which was very interesting, that in the millennials, they think they don't get the full disease, which is true mostly. But there's a term they've been using for these folks now in their 30s and 40s, healthy adults who are getting COVID-19 and they are not recovering beyond 90 days. They're calling them long haulers, and they're having encephalopathic symptom, memory loss, and then that's not happening as much in the senior population. So it's not the younger population won't have long-term consequences with their disease, and we don't know even the fit people are getting it. So it's something, if you can do, it's good to do. And if you want to do it, as Adam was saying, for your mom or your grandma, to protect them from not ending up in the hospital or intensive care. All right, so I'm very excited. We got a new routine for you guys. It's called Savasana, or other name for that is lion's breath. Lion is the king of the jungle, so we need to learn from how the lion breathes, and that must make him strong. So we're going to let's put some music, and then so that way you can participate that with me. See, all right, so here we go. So we got the music on. So what's lion's breathing? All right, so first you're going to breathe normally with me. Breathe in through your nose, and then fog the mirror. Again, breathe in through your nose, and then fog the mirror. Now you've done that a couple of times. Now let's just make sure you're sitting in a comfortable position. Most of you guys are sitting in a chair, hopefully not laying down. So sit in a chair, please. And if you can, have a yoga mat and maybe kneel. Kneeling is a very good position for Simhasana or lion's breath. And you put your both hands, spread your fingers on your knees, and then you can relax your shoulders. And then what we're going to do is we're going to squeeze our eyes and squeeze our face like this. Then breathe in, and then breathe out. So that's simple breathing, right? So now we're going to take it to the next step, which is the silly part and which is the fun part. So what you do is you breathe in through your nose again and close your eyes. Breathe in through your nose, and then push your tongue out all the way towards your chin, like that, and then breathe out. So breathe in through your nose, close your eyes, and then breathe out through your tongue, all the way out. Now the last part we're going to add is when you're breathing out, I want you to look up towards the sky like this. So it will be like this. You breathe in through your nose, keep your eyes closed, and then breathe out through your mouth with your tongue out, and then look up to the sky. So this is called Simhasana or lion's breath. What's the advantage of that? If you do it 5 minutes 3 times a day, it will open up your eustachian tube. A lot of people have allergies, and the Sahara dust bowl is coming our way, so we're going to have some allergies in the next few weeks. So it opens up your eustachian tube, which is a tube which connects your middle ear to the back of the throat. It also helps you open up your tear duct, so you get less dry eyes. And more importantly, you can get a deeper breath in and out of your lungs. So that's the beauty of Simhasana. So I'm going to do 5 with you, and then we'll call it a day. All right, so do it with me. Squeeze your nose, squeeze your mouth, squeeze your eyes, and breathe in. And then put your tongue out. Look up. Now do it second time. Breathe in. 3 more times. Breathe in. Breathe out. Breathe in. Breathe out. 1 more time. That's it. Wasn't that hard? It's called Simhasana or lion's breath. Wonderful way to relax and get your anger out or frustration out or get you centered, and do it 5 minutes, 5 times, 3 times a day, 10 times, 3 times a day, whatever. You can, get a time for that. With that, we come to the end of our Lily is here. Let me say hello to Lily. She said, Dr. Mahajan, that was educational. Thank you both. For me and Adam, thank you, Lily, for being part of our podcast. You've been a strong supporter. We appreciate that. In the end, the hospitals are ready here. So that's the good news. The bad news is we need to lower the flatten the curve. So we got to do our part to help the hospitals so they don't get overwhelmed. With that, we come to the end of our podcast. Be nice to yourself. Be nice to your family. Be nice to your biosphere. And I appreciate you tuning in. And we'll see you on next Thursday with another exciting podcast from Mahajan Medical Center. This is Dr. Ranjan Mahajan, board certified internist, signing off and thanking you for all your input. And do give us your love and share this podcast with your friends and family. Ciao.